Hello, everyone, and welcome to Inside Healthcare. We have exciting news to tell you about. Emergency medical services in the Twin Cities are among the first in the nation to study a new medication for traumatic brain injuries that could save lives. It's potentially a major medical advancement. We're very pleased to have with us to tell us all about it Dr. R.J. Frascone. He's the medical director of EMS, or Emergency Medical Services at Regions Hospital. So thank you for being with us.
Thank you for having me.
Very, very exciting news. But before we get into the medication and the study, how common are traumatic brain injuries? What are some of the most common causes, and who's most at risk?
It's one of the most common injuries we see. About 1.5 million per year. About 235,000 of those patients are admitted, and about 50,000 of those patients tragically die.
Wow. And the most common causes?
Actually, it's kind of interesting. The most common cause in the United States is falls.
Really? You would think it was maybe a car accident.
Yep,
or something.
that's second. And then assaults and that kind of thing.
And are there certain populations that are more at risk for it?
Yes, males have about a 2-to-1 risk over females. And the ages 0 to 4 and 11 to 15 are most at risk.
And exactly what is, technically or medically, what is a traumatic brain injury?
Traumatic brain injury is injury to the brain. It can involve either swelling or bleeding or both of those things in its most serious form.
And it can be a closed head injury as well.
Yeah,
right?
They can be closed or open. The majority of them are open. Are closed.
And does a concussion fit into that traumatic brain injury, or
Yes.
not to that level?
Yes, that would be the most common cause of traumatic brain injury. And of course, as everyone knows, we, over the last few years, have become much more aware of the seriousness of what we used to think of as simple concussions. They tend not to be as simple as we thought they were.
So we've got this exciting drug, a TXA. What is it? How does it work? And
Well,
I guess we actually used it on soldiers in the battlefield.
Yes, TXA is the abbreviation for a drug called tranexamic acid. It's a hard word, so it's much easier to say TXA. This is a drug which has been around a long time. It's FDA approved. It's been approved for the use by hemophiliacs in dental surgery. Recently there were 2 studies published, one involving soldiers and the other a civilian population, which looked at the use of TXA in severe trauma. And there were what we call signals in research, especially in the second trial, the CRASH 2 trial, where there were 270 head-injured patients in that trial as a subset of the entire population of the trial. And we saw a pretty substantial improvement in their survival in that group. The problem is the number was too small to come up with statistical significance. But that signal led us to believe that we needed to do a trial with TXA that is specific to head-injured patients.
And how does that work? How does
Well,
it help?
it's what we call a thrombolytic inhibitor, which means that it prevents blood clots from breaking down. It doesn't create blood clots, but it prevents them from breaking down. So if you have a bleed inside of your head, the last thing you want, if it's clotted, is for the clot to break down and to continue the bleeding. That increases intracranial pressure, which can lead to further brain damage and
That's
even
where you
death.
have the swelling, and
Yes.
you have to remove part of the skull sometimes.
Sometimes, yes. That leads us to another point, which is that we have treatments for closed head injury and traumatic brain injury, but none of them are very satisfying. So the House of Medicine has been looking for a long time for a better approach. TXA may be a better approach, or at least another tool in our armamentarium to deal with serious head injury.
And what did we learn from the use on the battlefield with the soldiers?
Well, again, we learned that the overall improvement was very marked in patients who got TXA who were severely traumatized. In fact, the patients who were most traumatized had the most improvement. And then in the subset of patients in the CRASH 2 trial, we noticed that there appeared to be an increased survival rate in head injured patients in that trial.
Wow. So without that drug, survival rate is what? How many people usually? What percentages?
Well, I haven't
know it's
figured
really
out the
hard to
percentage,
say.
but of the 1.4 million people who suffer TBI in this country, every year 50,000 of them die.
Wow.
Yeah.
Even one death would be too many.
And many of them are young. The other age range that is particularly susceptible are those over 75. So you've got kind of three groups, 0 to 4, the 11 to 15, and over 75. And again, even the most sophisticated treatments sometimes don't work in our current selection of treatments that we have.
So I understand the study's going to start the 1st of September and run for a year until next October.
It's scheduled for a year. We may go longer than a year. It's possible that the trial will go up to 2 years.
So how does it work?
The paramedics will deliver on a randomized basis either the medication or placebo. And then when the patient gets to the hospital, they will give another medication that's either TXA or a placebo. Again, it's blinded and randomized, and that medication will continue for the next 8 hours.
So besides health partners or regions, who else is involved with this study?
There's 4 ambulance services that are going to be doing this trial. The St. Paul Fire Department, Hudson Ambulance Service, which is St. Croix Ambulance Service, Health East Transportation, and Lakeview Ambulance Service, which is the ambulance service out of Stillwater, Minnesota.
Is there a certain number of patients that you need to participate in the study to say that we have enough now, or?
Yes, our goal, surprisingly enough, is only 4 patients per month.
Oh,
But,
wow.
well, there are some pretty, stringent entrance criteria. You have to be over age 15, and you have to have a certain level of unconsciousness, pretty severely comatose.
And what would be the potential side effects of it?
Luckily, the side effects of TXA are pretty rare. Not only is it a cheap drug, but it's also a drug which is associated with few side effects. The main side effects are there can be blindness and nausea, seizures, and clot formation. But those side effects have never been seen at the doses that we're using. And there also can be hypotension or low blood pressure, but again, never been seen at the doses we're using or at the rate we're using it at. It's very clear in the 2 previous studies that the risk-benefit ratio is easily met, that the benefit of the drug far outweighs any of the risks that might occur with this drug.
Wow, very exciting. So if someone wants to get some information about it, there's a number that they can call?
Yes, they can call 651-254-5303. If they call that number, they can ask more questions about the trial, any questions they might have. And if they've decided, no, I don't want this drug, we will send them a bracelet that they can wear. And when the medics see that bracelet, the patient will not be entered into the trial.
And there's no way of knowing when this is going to happen, so that's why
correct.
You need to know in advance. So what other things should people know about this drug, about this study, about traumatic brain injuries?
Well, it's a frustrating area to deal with. Of course, in my 38 years in emergency medicine, I've seen a lot of tragic brain injuries where we really don't have a very effective way of treating them. And hopefully this drug will help us treat some of these pretty severely injured patients, remembering that brain injury can cause death, but it can also be very debilitating. Some people might even say that some of the debilitation that you see with brain injury is at least as bad as death. So patients spending the rest of their life in nursing homes, et cetera. So these are unsatisfactory outcomes this type of research hopefully will help not happen.
I was just talking with a friend this morning when we were walking, and she was saying how her brother had traumatic brain injury, and he committed suicide a year ago as a result of his future with the traumatic brain injury, and so very tragic.
Yes.
Long-lasting, yeah.
One of the aspects of this trial is that it is what we call an exception from informed consent trial, which the FDA allows if the problem is severe enough and the data is good enough to support it, and the clinical condition requires immediate therapy where the patient cannot give consent. So again, these trials are watched very closely, and part of the process is to notify the community that this trial is going on. That's what this interview is about. It's part of our obligation and our intent to notify the community, so to satisfy both the Federal Drug Administration and the local institutional review boards. This is our fourth such trial in EMS. We're very experienced with these trials, and so far everyone has agreed that, again, the potential risks of this drug are far outweighed by its potential benefit.
Wow, just amazing. It's very exciting to hear medical advances like this that
Yes.
can really make a difference.
Yes, it's a good time to be doing resuscitation research because we have a lot of exciting things that we're doing.
Well, Dr. R.J. Frascone, thank you for being with us. It's been a pleasure to have you with us.
Again, thanks for having me.
So thank you, and thanks. Good luck on the study.
Thank you.
We'll have to have you come back after it's all done and tell us how it goes.
You bet, we'd love to.
All right. Still ahead, an amazing group of local women. Stay with us, everyone. Thanks.
Okay.
Kids will spend 57 minutes making me go splat.
Brushing for 2 minutes now can save your child from severe tooth pain later. 2 minutes, twice a day. They have the time.
There's an amazing group of local women called Dragon Divas. They're all breast cancer survivors. In a moment, you'll meet two of the Dragon Divas. But first, let's take a look at the Dragon Divas in action last summer at Lake Superior, thanks to WDIO TV.
We're happy to be here. We're happy to literally be alive.
It's a story of hope and courage.
We've all been through the same thing. We've all been through breast cancer. We understand where each of us is coming from.
They are the Dragon Divas, made up of women 30 years old to 70, of mothers and grandmothers. And they've all survived breast cancer.
This has been like a beacon of hope to breast cancer survivors that you can go out and you can do what you want to do. You can be healthy, you can be strong.
They are survivors, but once they put on that life jacket and pick up that paddle, you better watch out, because they are fierce competitors.
We all know how to have a good time, but when we're out on the water, we are heads in the boat. We are focused, we are ready to go.
Dragon Divas, Minnesota, Team Courage.
On the water, it's all about racing against the clock.
We don't care about the other boats where they're coming in. We want to do the best time that we can do.
In 2 minutes and 1 second, they finished with their fastest time yet.
We improved our time by a second. So it is just awesome. We're all breast cancer survivors, and it is so awesome to beat a team that has men in it.
And after they finish, the Divas, along with 5 other teams paddling for cancer, take time to remember those that lost their battle.
We're remembering all the people that have gone before us.
Moving on to the finals is an added bonus for these Divas who paddle for just one reason.
Showing all the women out there who think that life is over, not going to be able to exercise, I'm not going to be able to, continue to do what I do. Absolutely not true. You can do it.
And we're very pleased to have with us two of the Dragon Divas in person, so that's awesome. We have Ione Livingston and Sheila Ludden, so thank you both for being with us.
Thank you.
Thanks for inviting us.
Before we talk about the Dragon Divas, how are you both doing? I mean, how are you feeling these days?
I'm feeling better than I ever have before. I'm probably fitter than I've been before and enjoying life every day as it comes.
And Sheila?
I agree. I'm here and I'm so happy to be here, and I'm living life to the fullest every day I can, trying not to look back, only looking forward and loving every minute of it, being active and really appreciate being alive.
I've always been so impressed with the Dragon Divas. I've watched you guys compete in some of the races, and how did you get involved and why? Either way.
I started about, well, this is my 4th season, so I started 3 years ago. I went to the boat show in White Bear Lake at their, I forget the name of what's the name
Manitou
of it? The
Days.
Manitou Days
Yes.
antique boat show, and the dragon boat was there. So I was pretty interested in it, and then I saw the breast cancer symbol on it, and so I couldn't wait to get involved. I'm an active person generally, but to find people my age willing to get out there and really do things, I was very excited about the opportunity, and so that's how I became a member.
And the way that I was invited by a coworker, who was a nurse for the school district, and she came into my office and she said, "Ione, what are you doing tonight?" And I said, "Well, I'm going to go home and make dinner." She said, "I've got something else for you to do. Why don't you come with me to White Bear Lake and we're going to go on a dragon boat?" And I said, "What is a dragon boat?" She said, "Oh, just come." So she gave me the address, and so I went home and I told my husband, which was even a big, "What are you getting into now?" And so I ended up going out there that night. There were 12 of us that night, and I was hooked from the minute I got on the boat.
What is it about the boat? What is it that is so enticing and so fulfilling and exciting? And I can't think of, I mean, there's just so many adjectives.
It's a whole scope of things. I think for me, I find serenity on the water. We have loons, we have eagles, the wind, the water. It's all healing. You're with, I like to call it our floating support group, because you're with, it's one heart, one paddle, one boat. We're all together. And so it's just a whole conglomeration of things. And the other thing too is that paddling adds that fitness part to it too, besides all that other stuff.
I've been on the water my whole life in different kinds of boats. I canoed a lot. We bought kayaks and I was out kayaking. But what's new about the dragon boat to me is the team, the spirit of we're all in one boat together in every level, on the spiritual level, on the physical level, on the emotional level. And we've got each other's backs. If someone can't paddle, we paddle for them, and we still want them on our boat. So the team spirit is what really is unique to me about the dragon boat. Besides, it's really cool and really fun.
So why is there a dragon? Why is it a dragon boat? Why a dragon head? I mean,
the dragon boating is an ancient Chinese custom. The dragon is a symbol of hope and courage, which we have on the back of our shirts. I don't know if I can turn and show the back of our shirts. But anyway, so that kind of carries through with what we're all about. We're about hope and courage. You get a diagnosis of cancer and you think it's the end of the world. Dragon boating shows you that it's not the end of the world. Like Jen said on the video, it's not the end of the world. It's almost like for us a start.
True.
Yeah, it's like
a
whole
second
new
chance
outlook
of
on
life.
life. Yeah.
So how difficult is it to do this? I mean, you've got a paddle here, and you were letting me try it before we started, and it is so light. I was expecting a really heavy oar here.
No, the heavy part is pushing the water. The paddle is...
You're all doing it together, right?
You all do it at the same time, so timing is really important. It's almost like a dance. In an actual race, we have one person in the front beating a drum, but we also watch the people in the front of the boat, watch the leads, and the whole goal is to be moving as one. The boat, if you get the best glide, if we all paddle at exactly the same time.
And you practice all the time, year-round?
Monday, Wednesday, Fridays. We can, of course, practice. I mean, Monday, Wednesday, Thursdays.
You could slide on the ice, no?
So during the off season, we have actually started different types of training. Like last year, we did Zumba.
Very fun.
We did some core training, and what was the third thing? We
plyometrics.
Yeah, the plyometrics and a little bit of weightlifting.
I can see how that would all be valuable.
And
Yeah.
also yoga.
And then keep you fit throughout the
And we
week.
have a lot of fun doing that too.
Yeah.
You know, so it gets us together in the off season too.
Part of our mission is to promote year-round fitness. So we encourage all of our divas and everybody to just be as active as they possibly can.
And you were telling me before also that there's a couple of different groups within the group. That some are the courage group, some are the hope group, and some are, I forgot what the third one is.
Oh, it's recreational paddling.
So
well, it's actually called the happy hour, but there's no alcohol involved.
Happy because it's fun.
That's right. That's right.
What are the different groups?
The courage group is the group that paddles twice a week, probably a little bit more competitive, although Sheila is on the Hope team and just as competitive as I am. So you have the people that are paddling and that can paddle, you know, twice a week, and then Hope is the team that Sheila's on.
Mm-hmm. And we paddle one time a week. We ask that you try to paddle once a week. And then we also offer happy hour, which is for the more recreational paddlers, the people that either can't physically do as much or are at a different stage in treatment. Some people we have on our team are very early in their treatment, and other people have been out many, many years. And so we have a variety of ages, a variety of fitness levels, a variety of experience, and so we try to offer something for everybody in our paddling times. We actually bring the boat out on the water, that'd be 5 times a week with different groups.
And where's the boat at?
Lake Jarvis. Yeah, we keep it at Lake Jarvis. One of our Dragon Divas lives on Lake Jarvis and is generous enough to house the boat there. So we come and go either from her dock or over at the Ramsey County Beach that's right across the way on Lake Jarvis.
And the lakes are connected, so you have Jarvis, and then you have Spoon Lake,
that's right.
and then you have Keller.
And Coleman.
And Coleman is like on the other corner. So our most exciting time, though, is when we paddle, and then we're by the bridge on 36, and people are honking as they see us paddle under the bridge going over to Keller.
Wow.
So
yeah, I mentioned before too, I've actually been up at Lake Superior and seen you guys compete, and it was so exciting. Mm-hmm. And that traditionally or historically, a lot of the people that you're competing against were not breast cancer survivors. Mm-hmm. So that was good for you guys to be able to get out there and compete against them. But you said now that even though you're still competing with different groups, that you're winning now.
Well, we're doing better. I don't think we're beating the hot shots or anything like that. But we're more competitive in that we're getting better because we've hired a coach who's really steering the group to be work more as a team, to work on our paddling stroke to make it more efficient. And so we're able to actually, get through the water a lot better than we used to be able to.
And she's actually a lot more than a coach. Our dragon boating and the breast cancer thing is like a passion for her. So you really feel when she's coaching us that she really cares about us. She's just like a gem.
And you've got a big competition coming up, international.
Yes.
Why don't you tell us about that?
The international competition is in Sarasota, Florida. We have a funny story about that too, but I'll tell that later. But anyway, this year in Sarasota International, there are like 7 continents involved, 102 teams. This will all be breast cancer survivors.
Wow, oh, how amazing.
And for our team, there are 52 of us going, and so we're going to have 2 boats in that competition.
Oh, I wish you all the best.
It's twice as many as went 4 years ago, so that's how much our team has grown.
Okay, and then I have a funny story about that, is that when the last international competition we went to was in Peterborough, Canada. And there were the same international. There were only 75 teams, but the joke got to be that we were the team to beat because we were 75th. This year we are not going to be 75th because of just the training and more experience and
I don't think either one of our boats will be 102.
No,
I don't think so. But you never know, and we usually win the Team Spirit Award, so what's the difference, huh?
Of course you would, yes. Who wants to win when you get the Spirit Award?
I agree.
That means so much more, it really does.
It does.
Yeah. Listen, talking to competitors, winning also adds to the joy.
Well, you're already winners, you know.
Yes, we're here.
You really are.
We're very much
really
here.
are winners. So if someone wants to go see you guys, where can they catch you guys in action? Besides maybe going.
Well, this coming Saturday in Fort Dodge, Iowa, we're going to be racing a boat there. Also in August, is it the 23rd?
The 23rd.
Of August in Superior, Wisconsin for the Lake Superior Dragon Boat Festival.
And the Superior does have a breast cancer division. So, and last year we won that, and we took third place in the women's division, where we raced against the University of Minnesota hockey team. The girls.
Right.
The girls, yeah. So
good for you.
And then September 20th we are in Oshkosh, racing in Oshkosh, and then October 24th we'll be in Sarasota for the International Breast Cancer.
Well, it's always a pleasure to have the Dragon Divas with us and tell us what you're up to, and so thank you so much. Final comments about what people should know about the Dragon Divas?
Well, how they can get a hold of us, and that's
Right.
going to be on the TV, right? Is at the Gmail.
At Gmail address.
And we have a brand new website that is called dragondivasmin.org. And anyone that's interested in us will get a really good idea when they go on that website. The website is brand new for us.
And we always look for new members. Unfortunately, if you have to pay the price to be a member, we feel bad about that, but not if you can be a Dragon Diva.
Awesome. Yeah, very nice. So thank you so much for being with us, both of you, and good luck on all of the races.
Oh, thank you for having us.
Oh, absolutely.
Thank you, Jody.
Thanks, Sheila and Ione. And we'd like to thank you for joining us. We hope you join us next time on Inside Healthcare. We'll see you then, everyone.
Inside Healthcare. For more information, visit stjohnshospital-mn.org or call 651-326-7800.